Hi, my name is Aracelis, and I'm here with my teammates David and Joshua, and we're going to present our Capstone project, Public Health Concerns Among the Aging Population in Puerto Rico. To give a little summary about the project, Puerto Rico is aging faster than almost anywhere else in the world. By 2020, 20% of the population was already over 65 years old, and this trend is only accelerating. In rural towns like Barranquitas and Comerío, older adults already outnumber younger working age residents, creating healthcare and caregiver strain. This demographic shift brings significant challenge like chronic disease such as diabetes and hypertension with the spread financial insecurity, social isolation, and unequal access to healthcare service. Our project aims to address these realities through a sustainable geriatric care model built on leadership principles and teamwork. Beginning with the introduction, I was saying earlier, Puerto Rico is aging rapidly. It is one of the fastest rates in the world. In 2020, 20% of the population was over 60 years old, and this percentage continued to rise. 10 years ago, we saw a big immigration again from the working age adults trying to bring a home, make a second chance, have quality of life, quality of education, quality of healthcare, expecting a better life because the political frame that we are seeing this like from the 2020 from now doesn't look good. It's more trouble. We passed the Hurricane Maria, and we saw the damage in the electrical system, and not only in the electrical system, in the health system, in the school system, and everything goes in that chain. So our project proposes a sustainable geriatric care model built on leadership frameworks, trying to trying to fix the challenges like chronic disease, social isolation, financial insecurity, and disparity in healthcare. Key issues identified. We identify 5 urgent issues, starting with the reduction in caregiving and social support. Many families migrate to the mainland, leaving parents and grandparents on their own here in Puerto Rico, and that's something from the culture in here. We are very family. We are always together. We live near, and you gonna to see that like the mom and the grandma does the succession of who gonna raise the kids, who's gonna be there when they go out of school, and give it some food and help with the stuff in the house and everything. We are like that. We have that is something very from here. Like always the family is there like for the care and for the caregiving support to each other. The second one is the financial insecurity. Almost half of the Puerto Rican live in poverty, and many seniors survive only on Social Security, which often isn't enough to cover medical bills and medication. And sometimes you go like to Walmart and you saw them in the doors, and you give the receipt so he can look the what you buy and look if something different in the car, of your still something. Also, you saw the other people in the roads, selling mangoes, plants, hamacas, different stuff there, avocados even, because sometimes they need something a little more for something, for the light, for the medication, or even for the gas in the car. The term healthcare access is the unequal the healthcare access is unequal. Imagine an older adults in Vieques, because it's a little island near Puerto Rico, and they need to see, for example, a cardiologist. They have to take a boat here to the main island and go to the appointment. Maybe it's in San Juan. From the port to San Juan, maybe it's like 2 hours, 3 hours, depends on the traffic. And I personally know friends that sometimes they have to go like to 3 or 4 hospitals, so the parents can have the service, because for example they don't have nobody in this hospital for epilepsy, and you have to go to another town to get the care. And the last weekend, one of my friends, she lives in a town called Camuy, and it's like 2.5 hours from Calle. Calle is in the middle, in the isle on the island. Camuy is in the northwest of the island, and her her dad have to drive through Camuy and then come back. It was like 4 hour drive to go to Camuy and then go to Calle. So sometimes it's hard. Don't mention we don't have a specialist. We have to wait sometimes 6 months or 1 year for appointments. It's kind of tricky, and it's exhausting sometimes, and it's difficult to have proper care in here with with everything, not only just for a specialist, for everything, inclusive for the general a general doctor. To have an appointment, sometimes you have to wait 1 day, 2 days, maybe a week. It's stuff that happens. The four is return the immigration. Many retirees move back from the main island, but often without local support system. Sometimes this generation, where they born, maybe they born here but raised in the United States, they coming back because of the taxes, of the paying rent in here can be a little lower, but it's not many houses. For example, I'm trying to buy a house. I can't, because there's no houses, there's no project going on. It's very hard, like, to settle down and started a family very fast. And it's not like that anymore. And finally, the austerity and pension cuts continue to erode stability for all adults. Continue with the past analysis. From a leader perspective, we look deeper and saw four key factors: the politics, economics, society, and technology. Politically, cuts in medical and Medicaid funds put the most vulnerable senior at risk. We are a commonwealth with the United States, so we receive a lot of funding, not only in the healthcare part, also in the educational part, and in aid relief when something like the hurricane happens. We 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 always have like a part of funds that helps to reconstruct everything. But the truth is, nothing happens. We never see the money, and is something that now with the political frame that we have with the president and everything what's going on, we don't really have the same amount of money than maybe 20 years ago we have. So economically, fixed income don't match the rising cost of living, especially after the Hurricane Maria that show us how the electrical system is here. We pay a lot for the electrical system and sometimes doesn't work. We don't have light. Sometimes we have 24 hours without light, maybe a week. Even even if don't blow the air, the the light is gone. Socially, the migration of young adults leave grandparents raising grandchildren, and reversal of role we see often in clinics, and we saw a lot of old have problems with the isolation. They are alone. Only sometimes they have is maybe a cat, maybe a dog, maybe a, a sibling, but it's sometimes it's hard for them because it they don't have like something to care or something to care about or something to do with the life. And we saw a lot of depressions in this population, and the technologically the telehealth has grown, but many seniors still struggle to use smartphones or lack on internet access, or they don't have the facility from somebody to teach them how to use it. Is is another That's another strong issue in here. The digital divide holds them back from care, or what to do, or they have to go to the to the clinic or to the center, and sometimes they don't understand how is the process, and is they struggle a lot with everything, and it's not great see it like that, like there's nobody trying to help this population, or it's not really a priority in this time. And like always, all the candidates for the governor, they use this population to make the campaign, but there's always forget when they won. So here is this is my last part. Now I'll pass it over to David, who will explain how we turn these challenges into strategy, trying to make a better Puerto Rico and better home to the aging people. Thank you.
Thank you, Aracelis. When we analyze strengths, weaknesses, opportunities, and threats, We found that Puerto Rico has strong cultural values like familism, where families prioritize elder care. But weaknesses include major physician shortages, since many leave the island for better paid abroad. Opportunities come from federal recovery funds and programs like PACE that can support elder care innovation. Threats include austerity measures, pension cuts, and climate risks like hurricanes, which disproportionately affect seniors. Our model draws from multiple leadership theories. For example, transformational leadership can mobilize churches and community leaders to hold health fairs for seniors. Situational leadership helps adapt training for caregivers with different education levels. Service-based leadership focuses on providing respite care so family caregivers don't burn out. Authentic leadership builds trust through transparency like publishing community health reports. And distributed leadership empowers seniors themselves. Imagine older adults forming local communities to curate walking groups or nutrition workshops. Governance is central to our plan. The Intersectoral Roundtable for Healthy Aging will bring together the Department of Health, insurers, hospitals, and community groups. Council of Older Adults ensures seniors themselves are represented. For example, in San Juan or Ponce, these councils could co-design new programs tailored to their communities. The action plan has four steps: assessments, co-design of care pathways, pilot programs in 3 to 5 municipalities, and then scaling to all 78 municipalities. Our timetable shows how this works in practice. In the first 6 months, surveys and workshops identify caregiving gaps. For example, a survey in Bayamon showed nearly 30% of seniors lack daily assistance. In the midterm, caregiver training programs will launch, partnering with the University of Puerto Rico's nursing school. And in the long term, services like telehealth units will be embedded in local clinics, reducing the need for seniors to travel long distances. Now, I'll hand it over to Joshua, who will walk us through resources, challenges, and how we'll measure success.
Thank you, David. Resource allocation. So, our plan spread resources across 5 areas. These are healthcare, social support, housing, financial security, and technology. Healthcare. What can we do with these patients or the aging population? We can see the patient of or our abuelitos. So, we're going to try to expand diabetes and hypertension clinics. Why? Because these are the chronic diseases that are affecting most of the population in Puerto Rico. Social support. We're going to have meal programs and day centers. For example, a body program in San Juan to reduce loneliness by 25%. It could be San Juan or any other pueblo in Puerto Rico. So, because right now the island is overpopulated with our with our aging population, with our elders, and most of them are alone. They need help. So this could be the social support is very important. There can also be some. Sorry for that. They can also we can also make some programs where students in the university can just come and pick up some abuelitos and bring them to go shopping or any other place where they can have social support and and we help the students get paid, we help the elders get a ride, and everybody's happy because our abuelitos, grandparents are need our help. Okay, so housing. So we can just do some home modifications like ramps, grab bars so they don't fall. Maybe put some areas grip in the floors, and very important, a solar backup system for the aging in place. Why this is important? Because of chronic diseases. chronic diseases like diabetes and hypertension, especially diabetes, they need insulin. They need insulin to control the diabetes, and the insulin needs to be refrigerated. This was one of the most lethal reasons patient died in back in 2020 when Maria was it 2020. Maria happened in 2017. I don't remember when the Hurricane Maria hit Puerto Rico. Many people lost all of their medication, and the elderly died because they didn't have their insulin. Financial security. We could work with the pension reform. We can help with rental aid. Even we can work some part time for seniors who want to stay active. And you can be surprised with how many people over 80 years old, they're very active, they look very young, they look strong. And especially we have to allocate resources to technology, telehealth, glucose tracking apps, so seniors in rural areas can manage conditions from home. Some people drive 2 hours, 3 hours just to get just to go to see a doctor and be there for 5 hours more and then head back. That's crazy. So we need to spread these resources across all 5 areas: healthcare, expanding diabetes, and hypertension clinics. Remember this. Of course, challenges remain. Challenges will always remain. Challenges are part of our life. And the best part of the challenges is that we come with solutions. So, what challenges are we facing in Puerto Rico? That some seniors live alone because of the children are abroad. They're in the States, they're in other countries working, having their own lives, which is normal. So, we can include respite services and adult day centers. Other issue is that they skip medications. Some skip medication because they forget, but most of them due to the high cost. So we can work with subsidy programs, and financial workups can also help. In remote areas like Vieques or the center of the island, seniors must travel hours for specialists. How we can help with this? Telehealth, that's a huge plus. Mobile clinics, but also we have to include education. Not all of our abuelitos know how to work with an iPhone. They are growing, they are learning, but it's always a gap. Okay? Return migrants, including veterans, often need housing and reintegration services. And austerity policies like pension cuts require strong advocacy and new funding streams. So it is a problem that we are facing in Puerto Rico. Uh, well, I think in the United States too, we have issues with housing. We have issues because there are not enough houses, or the rents are too high. So we are still working on how we can help returning migrants to the island and and reintegrate their services. How we will be measuring progress. We can track outcomes, for example, like fewer ER visits for diabetes or improved blood pressure control. Uh, we can also measure social well-being. For example, in San Juan, a senior body program reduces loneliness by 25%, like we discussed earlier. For sustainability, we tie funding to value-based care, train geriatric teams, and diversify revenue streams with public-private partnerships. And we design disaster resilience into the system. Solar powered clinics and telehealth can keep seniors safe even after hurricanes. How we will be scaling? We can scale and expand through all 78 municipalities, or we can just divide the island in three areas: west, east, north, and south. And all the metropolitan area is very populated, and we also have a lot of elder people there. But that's how we'll be working with. Also, if any of you have any other recommendations, we will be happy to receive them. Uh, Maybe this could not only be a project. We are very encouraged to put this in place uh, and work with our seniors in Puerto Rico. In conclusion, Puerto Rico's aging population is a serious challenge, but it's also an opportunity to innovate. By using leadership driven community based strategies, we can ensure dignity and autonomy and equity for older adults. If done right, Puerto Rico could become a model for other countries in the Caribbean and Latin America. This project reflects what teamwork and leadership can achieve when facing complex public health challenges. Thank you. And as I said in the previous slide, we are you are more than welcome to chat, to give your ideas. I see these as a pilot research that could be real, that can be real, and I myself am very encouraged to open up, not in San Juan, uh, open up a housing program for our elders in the West Coast. Thanks again, and congratulations, graduates.